Hi, my name is Eric Roof. I'm the CEO of Barber Community Health Association, and we're here today with two of our physicians that we have on staff. Dr. John Henderson is with us. He's our medical director, and Dr. Cecil Holbert, who is our physician at Myers Clinic, one of our physicians there, and also recently stepped into the role of county health official for our local health department. So we have a couple of experts here today. And one of the things we want to talk about is flu season that's coming up, as well as how that's going to blend with this COVID-19 pandemic that we're dealing with too. So I'm going to start with Dr. Henderson and kind of get your thoughts on why is it so important to get a flu shot this year?
Well, it's typically important every year, but I feel it's more important this year because of the COVID-19. The symptoms of the flu, COVID-19, and even a common cold are very similar. And if we can decrease the numbers of one of those three, which a flu shot would do, then it would help make the picture clear when and if you do get sick, whether we need to worry about the flu, common cold, or COVID-19. And it's possible that you could get both COVID-19 and the flu at the same time, which probably would not be good. So if we can decrease our number of cases of the flu, we need to get a flu shot, which is the primary way to fight the flu.
Very good. Thank you. Thank you for that. Dr. Holbert, I'm kind of curious about, we keep hearing that symptoms of cold and flu and COVID-19 are very similar. How can we tell the difference, or can we, and what's the best way we should approach that?
Well, unfortunately, the symptoms of COVID-19 and the flu are very similar. In fact, fever, cough, and shortness of breath are kind of hallmark symptoms for both. Although with COVID-19, there can be more of the shortness of breath symptoms. So it's very important for us to do all we can to prevent this from kind of confusing the picture for us, to protect as many people as possible. We're also not sure what effect everyone wearing masks and social distancing will have on the flu this year. There could well be less flu activity than in previous seasons, but we just want to do everything we can possibly do to prevent people from getting the flu while simultaneously trying to prevent people from getting COVID-19.
Dr. Henderson, go ahead.
If I could add another reason why it's important to get the flu shot. Flu shot, of course, protects you, the person that got the shot, but it also protects everyone else that you may come in contact with, because if you don't have the flu, you can't spread the flu. So you protect yourself and everybody else that you would come in contact with.
Very good. Dr. Holbert, I keep hearing wondering about when the best time to get the flu shot is. Is it October, November? Did we get 2 flu shots or 1? Any thoughts on that?
In previous seasons, I've typically recommended people wait to October or November to get their flu shot. The flu shot takes about 30 days to get to its full potential immune response in patients, and then it offers about a total of 120 days of protection. This year, the CDC is recommending everyone get their flu shots earlier if possible, and specifically emphasizing that children that have not had flu shots in the past get both doses of the flu shot as early as possible. So children 9 and under, if they've never had flu shots, should get 2 doses for the first time ever that they receive the shots.
And we are offering the flu shots and all of those dosages at Belington and Myers clinics, as well as our school-based centers. Is that correct?
Correct.
Excellent. Thank you so much. So I'm just curious, one piece of advice from each of you, this is a question for both of you, is if there was one thing that you would like our community to know, our patients to know, what's the best thing they can do to stay healthy this season, to make sure that they're taking care of themselves and their families? So we'll start with you, Dr. Holbert.
Well, it's hard if you just want one piece of advice, because a lot of these pieces of advice go together, but stay home if you're sick, socially distance, wear your mask when you're out in public, wash your hands, eat healthy and try to exercise, because being a healthy person is the best thing you can do to protect yourself against serious illnesses from these. But that's just a few things that are very important this year.
And sorry, John, I kind of set you up. I gave him first dibs, so he probably answered everything, but maybe you can add to that. Anything you'd like to let our folks know?
Yeah, he gave all the easy ones. I would say, of course, the flu shot is utmost important. The other thing is we need to change our mentality and not just tough it out and go to work or tough it out and go to school. This is the time that if you're sick, stay home. You know, if you have anything where you think might be the flu or might be COVID-19 and you're not sick enough that you need to go to the doctor, you are sick enough that you need to not go to school or go to work. It's a whole different mentality that most of us have to try to adopt. Most of us said, "Oh, I'm sick, but I can go to work." You know, this is the time to stay home.
Very good. Well, I thank you both so much for taking time to chat with us today. And I know the community will appreciate hearing from both of you. And have a great rest of your day. And we'll see the rest of you soon. Always happy to be here for our community. And just remember, turn to better healthcare.